These are the treatment for stage 1 prostate cancer. First of all, I think it's best to define what stage 1 prostate cancer is. And that's usually a cancer of the prostate that is detected more than likely by an elevation in the PSA. And a PSA is a blood test that we use to screen men for prostate cancer. And traditionally in the past, if that level was above 4, that would usually signal a referral from a primary care doctor to the specialist. More recently, we've also tracked the trend in which the PSA changes. If that PSA is rising quickly, even though it's under 4, then that would also trigger an evaluation as well. So what you're primarily dealing with is a process in which the cancer is confined within the prostate, and that in most cases it's something that we cannot actually palpate or feel a nodule. So, the treatment option sort of depends on, first of all, the age of the patient as well as their overall health. If someone is a young individual with relatively in good health, then usually the options include surgical removal of the prostate, and the other option would probably include some form of radiation therapy as an alternative. There are also other treatments which include what we call cryotherapy, which basically involve freezing of the prostate. That tends sometimes to be more reserved for patients who are a little bit older, who may be not as in good health. And so these are some of the options that are available. In addition, the other option that potentially can be on the table is watchful waiting, or active surveillance are some of the terms that we use. This basically involves having the patient being followed and monitoring their PSA and having a routine prostate exam when they're seeing the urologist. And that certainly can be appropriate if someone is found to have a small amount of disease on a biopsy, and those individuals certainly can be monitored without having to undergo any form of therapy.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.